Millions of Americans struggle with getting enough sleep at night, and it can have a huge impact on your health. But there is good news. Help is available to solve many of your sleep-related problems. In this week's Medical Center Health Systems Taking Care of You, we're talking with Dr. Ganta about sleep apnea and the solutions that are available. Dr. Ganta, I guess let's start with the basic. What is sleep apnea?
Sleep apnea is a very common condition, and it consists of people having some pause in respirations, that means breathing, and that pauses in breathing are going to cause some bodily changes that will make people feel very sleepy and not well during the day, and also it has some medical consequences.
People say, I catch my breath, or I stop breathing for a moment. Is that true?
This is happening during the night while the person is sleeping and they are not even aware.
So maybe your spouse or your partner hears that you're gasping for air.
That is correct.
Is this mostly seen in adults at sleep apnea? And are there certain adults who, if you're overweight, if you battle those issues, does that tend to all tie together?
Yes, it is more common in adults from middle age to older people. But again, unfortunately, it is related to body weight. It is more common in obese people, but it could also happen in normal weight people as well.
Yeah. Okay, so let's talk about the diagnosis and the treatment, because I know people sometimes get nervous about diagnosing it. Because one of the things that you can do is go to the sleep clinic and allow the doctors, the experts, to evaluate you. So how do you diagnose sleep apnea?
If somebody is snoring and they don't feel well, they can talk to their doctor, and then we look for other clues of whether they have sleep apnea or not.
One of the things you will do is have them come into the sleep clinic. It's not scary, right? There's no judgment about what happens in the clinic. It's an evaluation.
That is correct. It is painless. It is very comfortable environment where the test is going to be done.
People think they won't be able to fall asleep once they get to the clinic, right? They almost always do.
They always think, but to their surprise, we see very few people are not able to fall asleep. Most of the people are able to fall asleep very comfortably, and we are able to get the information what we need.
And then last question I have, the treatment. Is it the mask? Is that the primary treatment? Are there other treatments? And how does the mask affect your ability to get good sleep?
First of all, whenever sleep apnea is diagnosed, most of the patients are overweight. Our first recommendation is try to lose weight. And obviously it is not going to happen overnight, and it's also hard to do. Then the next best treatment is CPAP mask.
Okay. So
basically in here what is happening is the person without the CPAP mask are having some pauses in breathing. So by pushing air under pressure, the airway does not collapse anymore, and they will not have any pauses or shallow breathing, and then all those things will be corrected. Basically they will wake up feeling refreshed.
You feel so much better. I know from personal experience, a family member of mine has taken the steps to do this, and her quality of life has improved so much because of it. So Dr. Ganta, thank you so much for being our sleep expert. It's a big topic, and if you have questions, you can call them at the Sleep Center and they will get you taken care of. Thank you so much for being here today.